The legalization of euthanasia is one of the most polarizing topics in modern medicine. Hello, my name is Amrit.
And my name is Arjun, and I will be introducing the topic of our podcast. So, our topic is the ethical concerns surrounding euthanasia and assisted death. The objective of this discussion is to present the ethical dilemmas surrounding assisted dying and euthanasia. We chose to focus on euthanasia as our topic due to our volunteer experience at the Grand River Hospital, where we've had meaningful conversations with elderly patients. Many of these individuals have shared their perspectives on assisted death, expressing genuine interest in the option as a way to manage end-of-life suffering. In a particular case, a patient with chronic kidney and liver problems ordered countless magazines and books surrounding the idea of assisted death, and she specifically expressed to me how she strongly feels that this is the path for her to happily live out the rest of her life. These interactions highlighted the importance of understanding and discussing euthanasia in practical settings.
We have also learned about different ethical concerns surrounding euthanasia in different courses we've taken throughout university, but want to delve deeper into the topic as we feel there is much more to be learned.
Some major arguments that we will present include utilitarianism and Kantianism, as well as other ethical theories and their arguments for and against euthanasia, the Canadian MAID program, nurse morality, mental health concerns and eligibility for euthanasia, as well as autonomy.
To begin, let's start by discussing the definitions of euthanasia. Terminology surrounding euthanasia can be confusing due to the various descriptive words that are used in conjunction with euthanasia, such as active versus passive euthanasia, voluntary versus involuntary euthanasia, direct versus indirect euthanasia. So generally, euthanasia is defined as an act or method of causing death painlessly, as to end suffering. Assisted dying includes the spheres of physician-assisted dying, PAD, or voluntary active euthanasia. So active euthanasia is intentionally ending a life through a specific action, while passive euthanasia involves inducing death by withholding life-preserving measures. Voluntary euthanasia occurs when a person requests it knowingly and voluntarily, while involuntary euthanasia happens against a person's will. Direct euthanasia is the active and intentional ending of life, while indirect euthanasia involves allowing death without a clear connection between, for example, giving a lethal dose of a medication and resulting in a person's death.
Now I will be speaking about the Canadian healthcare system's perspective on euthanasia. It is called the Canadian Medical Assistance in Dying, or MAID for short, which was introduced in 2016 as a part of Bill C-14. Bill C-14 has an objective of finding a balance between respecting the autonomy of eligible patients and the protection of vulnerable patients. The bill viewed these three groups as ineligible for MAID. Mature minors is the first one. Secondly, patients wishing to access MAID at the direction of medical directives, which means patients that wrote what their wishes were before entering their medical procedure in case they may not be able to communicate later, and patients with an underlying mental illness.
A study conducted by Nunn et al. States that people's reason for requesting MAID was a loss of autonomy, loss of independence, loss of purpose and enjoyment, loss of physical and communication abilities, and suffering or fear of future suffering. Now, this was how MAID worked in 2016, but the MAID program has had many updates since then. Bill C-7 was introduced on March 17, 2021. This law stated that the law will no longer require a person's natural death to be reasonably foreseeable to access medical assistance in dying.
There are two methods of MAID available in Canada. Method 1 entails a physician or nurse practitioner administering a substance that causes death called clinical administered MAID. This is similar to a drug injection. And method 2 is a physician or nurse practitioner who provides or prescribes a drug that a person can take themselves to end their own life. And this is called self-administered MAID. So, to be eligible, you must meet all the following criteria. You have to be eligible for health service funding, be at least 18 years old and mentally competent, have a serious illness or be in health decline that cannot be reversed, or experience unbearable physical or mental suffering from a disease that cannot be relieved. Make voluntary requests for MAIDs, and give informed consent to receive MAID. In fact, in 2021, MAID accounted for 3.3% of all deaths in Canada, with some regions reporting up to 7%, and this increases drastically every year.
Colo et al. Conducted a study on identifying policy gaps in the Canadian MAID program. Many legal experts and social justice organizations argue that Canada's MAID program disproportionately targets marginalized groups and vulnerable Canadians. This is Indigenous peoples, peoples with disabilities, and people in poverty. This occurs because critics believe that the MAID program may seem like a solution to their hardships. The government agreed to extend the MAID program to people with only mental health conditions by March 2023. But this extension faced a lot of backlash from psychiatrists, as they pointed out mental illness cannot be reliably declared incurable. Studies showcase that mental health conditions are mostly untreatable, and individuals in the Council of Canadian Academics have warned that offering MAID to individuals with mental health issues could encourage patients to choose MAID instead of recovery-based options.
Moving on to the ethical theories and how their ideology concerns euthanasia and assisted dying. Utilitarianism states that an action is inherently good if there are more good consequences than bad. Thus, people who believe in the legalization of euthanasia think that the good consequences outweigh the bad ones because of the respect for the autonomous decisions of terminally ill patients.
Now, utilitarianism also provides many justifications against euthanasia. People with a utilitarianism perspective against the legalization of euthanasia may state that legalization may eventually lead to involuntary euthanasia. Involuntary euthanasia is the ending of lives of persons against their will. An example of involuntary euthanasia being used is the one of physicians from Netherlands reporting that they have given lethal injections to patients without their formal approval. People that hold a utilitarianism perspective against the legalization of euthanasia may also state that distrust of physicians may increase if legalized because physicians may prioritize saving resources than providing care to patients. And this may cause physicians to coerce patients into requesting euthanasia. Another argument is that legalization may cause human life to be devalued, which can lead to many unforeseen consequences in society. An example of this can be people with disabilities or terminally ill conditions may feel forced to seek euthanasia as an option because society has pressured them to do so.
The second theory we are looking at is Kantianism, and that states that an action is good or bad for reasons other than the consequence of the action. A Kantianism argument for the legalization of euthanasia could be that physicians have an obligation to act in the best interests of their patients. This includes respecting requests to end suffering from terminal illnesses. Another argument for the legalization of euthanasia is that individuals have the right to make personal decisions, including those of the time and manner of their own death.
Some arguments against the legalization of euthanasia in a Kantianism perspective is participating in killing of patients is the opposite to the concept of being a physician. Euthanasia is the opposite of a physician's role because their purpose is to heal rather than end life in a Kantianism perspective. Kantianism also argues that taking an innocent life is morally wrong no matter the context, which is a principle rooted in many cultures and religions. Kantianism also is an ethical theory that is rooted in its rigidity. Thus, people with this perspective won't perceive that medical cases surrounding euthanasia have many nuances attached.
The third ethical theory being discussed is liberalism. Liberalism focuses on the autonomy of individuals and how their choices should be respected, and that others shouldn't make moral judgments for individuals. It also believes that healthcare practitioners' role is to facilitate choices and not make them. Those who hold a liberalistic perspective would argue that anyone who considers euthanasia should be eligible to make their own decision. A specific example is minors. Minors considering euthanasia are those who have gone through a lot of pain, and this means that they are more mature and therefore can make decisions for themselves, therefore are autonomous in their own right.
There are also arguments, on the other hand, that state that minors cannot make life or death decisions. This all revolves around the idea that age can be a limiting factor for making autonomous decisions, especially for something this instrumental. Thus, the age limit on euthanasia is very incohesive amongst the world healthcare community.